Hello, and welcome to Plastic Surgery Tales, the podcast about plastic surgery. Today, we're going to share the intimate and empowering stories of those who have chosen to take this journey. In each episode, you'll hear firsthand the remarkable journeys of our patients, but not just the patients. We're going to be sitting down with some of the world-renowned plastic surgeons who have helped us change these lives. Welcome to Plastic Surgery Tales. We have here today, we're sitting down with Dr. J.C. Alvarez, board certified for, 2012.
Correct.
Today, our focus is basically talking about the topics of following the major procedures that are common: BBLs, liposuction, tummy tuck, breast augmentations. And through your expertise, Dr. Alvarez, we want you to tell you some of the, what every patient wants to know. They come here asking all these questions, and we just want to get to the bottom of it. So before we dive into the essentials and navigate our steps through the recovery, one tale at a time. First, I want to say thank you for coming and sitting down with us.
Thank you for the invitation.
Yeah, and we can't wait to hear what you got to talk about.
Sounds good.
So, Dr. Alvarez, what are some of the immediate steps to take, following post-surgery?
Well, I will say that everything starts actually before surgery. You're somebody who comes here and say, hey, I want to have this surgery and I'm going to take care of my surgery and I will start going to the gym after my surgery. I will do my diet after my surgery and I will be a good girl, stop smoking and be good in life. I think you're starting in the wrong place. You need to do all those things before, because when you get accustomed to a routine, to have an exercise routine, to have a nice diet, to do exercise routinely, you're most likely to accomplish that after the surgery. Besides, you're going to be toning and preparing your body for the procedure. It's the same as I tell all my patients. You can go and say, I want to run a marathon tomorrow, but you're not likely to achieve the goal. But you tell me, okay, I'm going to train for a marathon and start training like 6 months before, and then 1 mile first, then 5 miles, then 10 miles. And then at the end, you're going to be able to achieve what you want to achieve.
So what you're saying, Doc, the post-op is just as important, the pre-op
Correct.
is just as important as the post-op.
Correct.
A lot of people try to leave that out as far as like, when they're getting ready for surgery. I have this remedy. I like to meal prep before surgery. Maybe 2 months before, I try to drop a couple pounds.
Correct.
I try to get into the habit of eating healthy.
Correct.
And watching my diet, because to think that the day before surgery, you're automatically going to snap into the zone of things, it's just not realistic.
It's not realistic.
And it's not realistic to maintain either.
Correct. And that's the most important thing. Yes, I have noticed that many people that undergo surgery have a self-confidence boost. And the reason is, hey, they're walking through the street and say, hey, girl, you look better. Hey, you look taller. What diet are you doing? Sometimes they forget about me and they say, no, yeah, I have been taking this diet and went to the gym, and they forgot they have plastic surgery with me. But it still doesn't matter. At the end, my goal is that to get them to the point that they feel, hey, I did something that I had tried to do for many years. Now I feel that I get more attention. And then when they go shopping for their new dress and they feel better, they say, okay, now I need to take care of this. That happens.
Yeah.
But going back to the original statement is, only when you start the process before, you can continue it after, because you're not trying to figure out what to, you know what I mean? For example, fajas. After
Fajate.
Yeah, fajate. So the question about fajas is a very uncomfortable device. I cannot imagine getting into one of those. I gotta say, I'm very proud of women that can do it every day in a very small fraction of time.
Yeah.
But you try to accommodate your body to the faja before surgery, then afterwards you kind
It becomes easier.
easier.
That is a good tip, to start wearing the faja prior to surgery so you can get adjusted into, if it's too tight, if it's uncomfortable. It's not the most comfortable thing to wear.
Correct.
But after surgery, you will realize how important it is, and your body doesn't feel too nice. It feels like Jell-O when you don't have it on.
Correct.
Yeah. Why is that?
Well, it's the best allegory or mnemonic that I have is, when you ride your car, you're accustomed to have your seatbelt. And when you don't use it, you feel like naked, you know what I mean?
Right.
You feel that not safe. It's just something weird about using your seatbelt when, well, people that you should use seatbelt when they drive. It's the same thing with the faja. It's just the compression. It's what helps the tissue to feel snug, and that snug feeling is what actually decreases pain, because when you're jelly, everything is kind of hanging. And that hang pulls on nerves, and those nerves generate the pain. But if you are snug, it's like having a baby close by. They feel protected.
When you wrap the baby up in the little worm blanket.
The same thing.
Right. Okay. What would be some things a person going into surgery should, or coming out of surgery, should expect? Like, when I come out of surgery, what is some of the recovery things I should be expecting, or monitoring things I should be looking for when I come out of surgery?
Well, very important things. After every single surgery, you're going to have a disbalance of the fluid and electrolytes of your body, because you then underwent removal of tissue. It can be fat in the case of liposuction, or actual skin and fat in the case of tummy tucks or breast reductions. So when you lose that tissue and you get all this fluid throughout surgery and you don't eat too well after surgery, the body gets a hit. And it's the hit of trauma. So when you are under trauma conditions, either because somebody hit you or you got into a car accident or you got surgery, the body reacts with inflammation. That inflammation generates a lot of things. One of those things is swelling. And that swelling is accumulation of fluid in areas that don't belong to. So within the tissues, usually the fluid is within the veins and the arteries.
How do you decrease that? The faja?
Yes. Another thing is not drinking fluids with too much salt, so you don't retain fluids in the wrong place. However, you need some electrolytes to balance all those things that shift up and down because of that.
Because you're dehydrated.
Well, and dehydrated, hydrated, because the swelling is water, isn't it? But it's water in the wrong place. Hydration is water in the right place, within the veins and the arteries. Gotcha. So when you have that disbalance, you need to balance it again. So Gatorade 2 is one of those ones. But
to replace the electrolytes.
But try to get that one that doesn't have not too many calories.
No alcohol.
Definitely not alcohol.
Can't take no shots, no bar parties.
Alcohol makes you pee too much, and then you're going to be dehydrating yourself. So obviously, once again, you're going to train for a marathon. You're going to start drinking the days before the marathon, because you're going to be...
You want to be in tip-top shape.
Exactly.
So how long do you recommend somebody who trying to get back, because you got this new body? Let's just talk realistic. You got this new body, you bought new clothes, you're dressed, you're like, I'm going out.
So it depends on the surgery. If it's a tummy tuck where you have to do way more work, you need to tighten those muscles, you need to remove some skin, you need to remove some fat, it takes a little bit longer, around 3 to 4 weeks, just to start getting back to your normal. When it talks to liposuction or transfer of fat to your body, it can be a little bit earlier, around 3 weeks or so. 2 to 3 weeks, depending on how tough you are with the pain.
Doc, listen, everybody's pain tolerance is different, right?
Yes.
With the BBLs, that is a recovery I don't even know how to explain, not being able to sit on your behind. Is it true if I sit on it too early that it'll get flat? Yeah,
and the thing is, it's like when you are molding Play-Doh. How you ever played with Play-Doh when you were a child? Do you know what Play-Doh is?
Yes.
Yeah, so you just create a ball, and then you just start putting
pressure.
Let's say half of your body weight in your butt, because half of the body is on top of your butt, isn't it? More or less.
This is why they recommend the BBL pillows.
Correct. So the butt is in there, and in that way, it doesn't flatten the same as Play-Doh will do. You put some pressure of a ball of Play-Doh against a table.
Yeah. I tell ladies, if you're anything like me and you're ready to get back outside to show off this new body, show off this new shape, I am one to just tell you my little story. I'm a recovered demon, meaning like I recover really fast. And everybody's like, how are you up and moving? How are you? I don't know. I just have a different pain tolerance. But, you know, being a social media influencer and just being this girl that's outside, and I wanted to go out. And let me tell you, I was in the club with my BBL pillow, doctor.
How long after?
Maybe like 3 weeks after. I went to a nightclub and I knew I couldn't just sit down on my bare behind. I had my little pink pillow, and I didn't care what nobody thought.
But that's an important thing.
Yeah.
State of mind is another important thing when it comes to recovery after surgery, because this is a good example. If you go to the gym and do 1,000 crunches for your belly, the next day you cannot move very well, but you feel proud that you did 1,000 crunches. You brag about it against your workmates.
Yes.
And then you feel good about it because you know that you did a good job. Imagine the same type of pain after you do a tummy tuck. The thinking process is different. Oh, somebody cut me open. Oh, somebody put sutures. Oh, I have these tubes coming out of my thing. Oh, poor me. Oh, I don't want to do. So that's the thing. It's the same pain, different mindset.
Different mindset.
So
and you did all that work.
Correct.
To not take care of it. It's crazy.
Well, but the point that I'm coming through is I don't want you to go back into the gym to do exercise immediately after a tummy tuck, but if you have a different mindset in which, okay, I have some pain related to my surgery that is equivalent to going to the gym and do 1,000 crunches.
Right.
What is the difference of behavior if it's the same?
So the way you eat, wearing your faja, taking your multivitamins, starting, because, you know, they say abs are not created in the gym, they're created in the kitchen.
Correct.
So the same aspect and mind frame should be applied when you have a BBL, you have liposuction, you have a tummy tuck. You should get into the swing of things on, okay, I'm going to start changing my daily routine and my daily habits.
Correct.
On, you know what I mean? So you can, Doc, I love it.
And actually, that's when I see my patients, the ones that do the best are those ones that already have a routine. And they want just to come to get rid of what they cannot take out in the gym.
I think a lot of ladies don't get enough information on how to handle and manage their lifestyle afterwards. So like, even like knowing that you just had a BBL, I go find dresses and outfits that I can wear my faja underneath.
Correct.
You know, instead of trying to get into the slinky, skinny straps and it's like, oh, well, I won't wear the faja today because I can't wear it with this dress. No, go find outfits and clothes, 2-piece long sleeve outfits. That way you can wear your faja, you can wear your board, you can wear the things that you need to wear.
Well, just to go close into reality is how many people use faja to disguise their rolls in their belly.
A lot.
It's not different than what you do afterwards. So it's kind of the same concept. You are somebody, going back to the beginning. If you try to do things ahead of, you will be ready to do things. And that's what they teach you in the army, you know. We don't want you to go and figure out how to fight when you are in war. We're going to teach you all the things, how to survive when you're thin,
right?
How to survive if you don't have water, how to survive if you don't have thin, how to use your firearms,
right?
How to grow up into and do the best thing to have the best outcome. So we don't send them uninformed, we send them informed so they know how to do under stress conditions. Surgery is stressful when you don't know and it's unknown because, well, unless you have many surgeries.
Right.
But if you know what you're dealing with and you are prepared, you're going to do better.
And that's
the key to all my patients.
You do better.
Of course.
You spoke something about pain.
Mm-hmm.
What are some like pain management advice you would give to someone who doesn't have such a high tolerance for pain or has never done this and doesn't really have the knowledge or expertise on, okay, I just had this major surgery. Mm-hmm. And let me tell you guys, going into surgery, it feels like you got hit by a Mack truck.
Correct.
So the medicine wears off at some point.
Correct.
And you have to tolerate the pain. What is your advice to those people?
So we mentioned already. So if you are trying to do going to the gym and feel that training of pain related to exercise, you switch the mindset of tolerance of pain.
Mind over matter.
Mind over matter. That was one first one. The second thing is many doctors and many patients rely on narcotics for pain control. I disagree with that. When you learn about pain, actually I learned this in pediatric surgery when I was doing my rotation in pediatric plastic surgery. I had this surgeon who was a young woman who was very knowledgeable about many things, and she taught me this. Pain has been studied, and there are multiple pathways how pain can be treated. There are 4 different pathways. So if you give a little bit of medication that affects or alters all of each of these pathways, you are most likely to have a decrease in the narcotic consumption.
Yes.
Because yes, can you go through the pain of surgery by just taking huge amounts of narcotics? Yes, you can.
Yeah.
But you're going to be
That's not a long
dull
time.
and stupid. You know what I mean? It doesn't make sense.
But it wears off.
And you will have all the side effects on narcotics and the possibility of getting hooked to it.
Mm-hmm.
So if you use little amounts of different things, you decrease the need for all those things. And at the end, you have a better result.
I know people want to hear like real live moments. When I had a BBL or any surgery I've had where I had to go under major anesthesia, the first awakening is crucial. Mm-hmm. It is terrible. You feel like death. It's just like, give me my medicine, get me the drugs. But I will say, because I have such a high tolerance, and like you said, it's mind over matter, after that first day, I get those narcotics in my system as obviously prescribed by a doctor, and taking the dosage that is prescribed to me. The next day, I this is just me, I don't even take the pain medicine. I take obviously my antibiotics, but I don't take my pain medicine after the second day. One, because I don't want to rely on it. I take me extra strength Tylenol.
Correct.
And I'm usually fine, and that is sufficient enough to control the pain.
Well, for example, in the technique that I use for pain control, I use Tylenol. I use ibuprofen, even though many surgeons think that it increases the bleeding source.
Bleeding, yes.
I try to take care of bleeding during surgery, so I know that I can give them Advil afterwards. The next one is muscle relaxant in case of breast surgery when I'm working with the muscle, or tummy tuck when I'm working with the muscle. Because when you relax the muscle, you don't have as much pain.
This happens inside the body, yeah.
And the last thing is the narcotic. So I usually leave the narcotic as a saving maneuver.
That if all fails.
Exactly. And then the other thing is giving you things that we know that they are not harmful. It's done with measurement, Tylenol and ibuprofen on the clock. Even if you don't have any pain, you're ahead of the pain.
You're ahead of the pain.
And by being ahead of the pain, you are less likely to
be in pain.
Pain that requires a narcotic.
What do you recommend? What movements do you recommend people to stay away from after having these major procedures like a tummy tuck or a BBL or lipo?
Yeah, so basically, tummy tuck, I would say, is the main one when position changes significantly because you are removing tissue and you're putting things closer. So it's the resting position. So the resting position for a tummy tuck is sitting position because it's 90 degrees. I remove the skin at 45 degrees. So if you're in 90, the skin is resting. There is no tension on the tissue. So basically the key to the point is don't put tension on the suture lines. So you don't put tension on the suture lines, there is no stretch. If there is no stretch, there is no pain.
What other activities would you recommend a patient to stay away from?
Anything that is heavy lifting. I restrict heavy lifting for 6 weeks, no more than 10 pounds. And then picking up things with a lot of effort. That includes babies, you know what I mean? Because babies are more than 10 pounds.
Right.
So you just freehand lift a baby, you may have a problem. So when you try to do things, have them close to your body because it's easier to carry something close to your body than far away.
This is why it's super important, guys, when you guys have surgery, to make sure you have a helpmate. Make sure you have someone who's going to help guide you through the surgery process so you don't have to do the heavy lifting. Can help you get in and out of the faja because it's pretty difficult in the first stages. If you're not a recovery warrior like me, where you're putting on the faja yourself and you're like, I got it, guys. Correct. It's actually easier for me to do it myself than somebody struggling. They take too long. I just like, let me just do it myself.
But you have experience.
I have experience. But for those that don't have experience, it's very important for you to have a helpmate, someone who is going to guide you through that process.
Correct.
Is there a time frame of complications that somebody should be on, I guess, a watch hour after surgery, looking out for certain things and certain red flags that could go wrong? So
usually is the first 30 days is the main time where things can happen. So in the process of surgery, the main complications, usually fever related, are related to the breathing. You have been breathing for several hours under a machine that is breathing for yourself.
Right.
And some of the areas of the lung is going to be collapsing. When they collapse, mucus accumulates on it. And by accumulating mucus, it can generate infection. So it's very important that you breathe in deeply, hold it for 5 or 10 seconds, and breathe out. When you do that, let's say 10 times every hour, that collapse lung is going to expand a little bit. And it might make you cough a little bit. But that is good because it removes all that mucus that might create a complication called atelectasis. Then
what is it called in my
atelectasis?
Atelectasis,
which is collapse of the lung.
The collapse of the lungs. Wow, is that common?
Actually, everybody has it. It's normal.
Wow.
But that's what you do. Deep breaths. Also, you can buy a machine in which you suck through the machine and you have to play a ball to a certain level.
They usually give that to like sleep apnea patients.
Correct.
Okay.
But you can do it for free by doing what I just mentioned. The second thing is infection of your urine. If you have some lung surgery, sometimes we put Foley catheters. We try to clean out things as much as we can, but sometimes people might have some urinary infections. That's a possibility. Common? It's not that common, but it's a possibility. And that usually happens between 10 and 14 days.
Doc, I got this one question. I know the ladies, they really want to know. Why do I always get my period after surgery?
Stress. 50% of the patients that I operate on, they have an unscheduled menstrual period the day of surgery.
I always try to plan this thing to have
stress. Cortisol.
I'm like, I don't get it till 16th. Let me schedule my surgery for the 5th.
Stress. Always.
It always comes. Stress.
Stress.
I got another question.
Sure.
It's not a complication, but I'm not in the mood for sex after surgery. Mm-hmm. Like, it took a while for my vagina to get back to wanting it.
Okay.
Is that normal?
Yeah, well, you're in pain. The last thing that you want to hear is that a guy just asking for things for you, you know what I mean? From you, I would say. So it's completely normal. It's like, imagine that your man was playing rugby and somebody hit him in the parts. Will he be willing to have sex with you?
No.
No way.
No.
Or he's just so tired, work hard, and is he willing to have sex? No way.
Right.
He can be a super macho man, but if he's in pain or overtired, recovering with a high metabolic demand of your body to repair something in your body, is he willing to have sex with you?
No.
No. So how is that different from women that have had surgery? The difference is that in our society, there's so many demands on women to look perfect, to always be available, to work a full hour time work, come home, take care of the kids, take care of the husband. That's unfair to women.
Mm-hmm.
So when somebody asks you for that thing, it's like, sorry, I'm recovering. My body has some other needs at this time.
Doc, you keep that mentality, you won't be single for long. You keep that mentality, you won't be single for long. It seems like you know a thing or two over there. What dietary recommendations would you have for somebody coming out of surgery or prior to surgery?
Dietary. So basically, once again, try to decrease the amount of sugars in your life because sugar is that devil. It's like worse than cocaine, you know what I mean? It's just like once you get into the habit of having some sugary thing in your mouth, it's really hard to not have it every day. And obviously, over time, that's what gets us to the surgery in plastic surgery.
Yeah.
Protein, increase of protein, at least 40 to 60 grams a day, either with vegetarian options, tofu, high protein veggies, protein, like animal protein. It can be from fish, poultry, or cow or cattle, and powders. Muscle whey protein, which is something that is available everywhere nowadays.
Yeah. People don't understand that foods, that's why we call them superfoods.
Correct.
Because they self-heal the body from the inside out. Like everybody's so focused on the exterior. Yeah, you got the plastic surgery now, but now you have to heal the body from the inside out. I'm a fan. Here's my routine when I have surgery. I love avocado. Mm-hmm. I love grilled chicken. Mm-hmm. I love hard-boiled eggs. Mm-hmm. Leafy greens like spinach. As far as my fruits, I love in the beginning especially, I love my pineapples because they help. I never get a drain. I know some doctors recommend drains, but for me, I've never had a drain. And so I find when I eat the pineapples, The bleeding literally stops in the next 3 days.
And the bruising gets better.
And the bruising,
And
yes.
the reason is that there's a substance called bromelain that
inside the pineapple.
And that's the only problem. Pineapple has a lot of sugar. So you eat a lot of pineapple over time, you can gain weight because of that. But bromelain is the same has the same effect as arnica, which is another anti-inflammatory that helps with bruising.
Is it true that affects your vision if you drink too much of it? If you take too much of arnica?
Have no clue.
Okay, because that was a myth that I wasn't sure if it was facts. They said the arnica's great, but if you take too much of it, it may affect your vision.
So I will add to those list of superfoods. Ginger, great anti-inflammatory.
Tea or the root?
Actually, you can do tea out of the root, which is the best way. But you can buy it in powder.
In powder.
Or you can use it as a tea version. Good. That's a good way.
Blueberries.
Antioxidant. So all those things are anti-inflammatory. So all are good things to have in preparation or after surgery, in the recovery time during surgery.
Are there any post-operative garments or aids that you would recommend besides the fajas after surgery?
Well, basically for tummy tucks, I don't like to use faja right away because the faja puts a lot of tension in the tissues, and that much tension when you remove
the scar.
Exactly. You can put pressure on the scar that we just repair with sutures. It can break the skin. So I like to wait 1 month for fajas when it's a tummy tuck.
So what's shaping your body in those moments of this? Because what if you...
I did it by cutting things and sewing things inside. So that's what it does.
Like you said, this stops the swelling. Correct. You try to take care of that.
Well, the swelling, the faja does a little bit of the job, positioning, but for the tummy tuck, I'm not that worried about that swelling because it's not that terrible. And usually by the month, you can start your massages and your result will be just as good.
So what if someone was having a tummy tuck and a BBL?
I used to do that before, but I stopped doing it. And the reason is, when you do a tummy tuck, how do you have to sleep?
On your stomach, on your back.
And when you sleep on your back, what are you going to be doing? It ruins the fat of your BBL. And when you do your BBL, how do you have to sleep?
On your stomach.
On your stomach. So you have cut and put you in 45 degrees, and how now you have to be in 90 degrees, you can open up your wound. I used to do it, and usually I didn't have any major complications, but the sacrifice is always in the non-cut area, which means your butt.
Right.
Or BBL.
I remember my first time getting lipo and doing my breast. I had did my breast and a BBL at the same time, the worst thing I ever did. And now that we're in 2024, a lot of doctors do not want to do those multiple procedures at the same time, like you said, because it's an inconvenience to the patient.
Well, there are two versions of the story, Many patients come and say, well, I live far away, I'm almost 50, and I don't want to go back to the OR again.
So can do everything right now, doc.
I'll say, okay, it depends. I'll figure out how heavy they are, how much I need to do. And sometimes, depending on what it is, I can deal with it. However, have you ever juggled with balls?
What kind of balls, doc?
Like baseballs. Baseballs.
Yes,
okay.
Yes.
If I give you one ball and you bring it to the other side, it's likely that it's not going to fall.
Right.
If I give you two balls, you might be able to do it maybe once or twice, and maybe one will fall at some point.
Right.
What if I give you four? How many are going to fall?
2.
I would say 3 or maybe 4.
Right. Because
you get so distracted, or for trying to get this, you lose this, and then you end up losing everything.
Wow.
Imagine that each ball is a different area where you had surgery. So you have your breast, you have your belly, you have your back, you have your arms, you have your chin, you have your inner thighs.
Everything's just in pain.
And then your body is trying to heal everything at the same time.
You're overworking it.
Exactly. So it's like an industry. You have a maximum production of whatever, let's say collagen and elastin, which is what you need to create the scar. And you're spending it everywhere. And then where are you going to fail? Usually through the areas that you cut.
You spoke about, after a tummy tuck, the positioning of the way you sleep. Could you go into other sleeping positions and ways to get some comfortable rest after not just a tummy tuck, but other positions? I know for me, having, the pregnancy pillow saved my life.
Correct. So for tummy tucks, at the beginning, I like them to be in a sitting position or a recliner, because it's easy to get up and you don't have too much help for that. And you can, well, not as comfortable, but somehow you can rest. However, after 2 weeks, I like them to go down into your bed in fetal position, so sideways, with the legs like crunch a little bit, because it's a comfortable position. We already said 90
the little
degrees.
baby cradle.
Exactly,
Yeah.
90 degrees is the most comfortable for the belly.
Right.
So you are sideways, you can do it.
When I find also, like, after having a breast augmentation, I'm scared to sleep on one side more than the other.
Actually, for breast augmentation, it's fine to sleep on your side.
Really?
Why? Because you want the implant towards the middle, yes?
Yes.
So you put your arm underneath.
But doesn't everything kind of shift?
No, but it's shifting towards the middle. So the arm is pushing the
This
implant
one
towards
this
the
way,
middle.
and then this
and
one
that
is
one is by
laying.
gravity.
Ah, you told me something today, Doc.
Thank God. So the wrong position is sleeping on your belly, because that puts pressure directly into your breast, and the implants go sideways. So sideways is okay, on your in your back is okay, but with a push-up bra.
I don't even go to sleep without. I'm a faithful
Why?
member of the sports bra
Because
family.
your chest wall is like a barrel, and your implant is going to try to roll towards the sides. So you have a push-up bra
to keep everything
in the middle.
In the middle. We're in Miami.
Mm-hmm.
Shout out to the 305. It's hot. It's sunny. There's beaches everywhere. There's pool parties every day. What do you tell your patients with sun exposure? How do we? I mean, for the some that travel from these cold winter areas, that may not be a problem. But here in Miami,
it's everywhere.
What are they doing?
The most important thing is to cover the incision with the bikini, or actually the full piece bikini.
The one
bikini,
yeah, okay.
To cover the incision all the time. Obviously, I don't want to expose the fresh wounds to water, because you remember what happens in the pools?
It gets soggy.
Well, first of all, the skin gets dehydrated and can get ripped, one thing. Second, kids pee in the pool. Kids poo in the pool.
No, they don't.
Of course. Also with the sea, you know what I mean? So try to prevent submersion, or put the incision underneath the water, because you don't want that. But if you want to share with people, you can cover very well everything with a one piece or something, and then you can share. But remember, immediately after surgery is not recommended, because we said already, you have this balance of your electrolytes, you are dehydrated, and you are outside in the
sun
heat.
Is not going to help.
You're going to hit the floor. So also be mindful of, you can share with people, be in an area that is well ventilated, a little bit cool, hydrate, share from the inside of your bed or your house. But
what do you think about sunscreen? Because I know when I got my breast done, a few weeks later, I was ready to go to the pool and the beach. And I was so nervous laying in the sun. I felt my chest getting hot, and I covered it with sunscreen, but I was nervous. Dr. Alvarez.
I don't think that sunscreen is such a good idea when you have fresh wounds, at least for 1 year after. Why? Because in the process of healing, the cells that are healing are super active and super sensitive to things. So you might not have any complications of the wound, but you're going to hyperpigment your incision. So if you have a perfect scar, but it's darker than normal, it's going to be noticeable. Usually,
because of the sun.
Exactly. So usually it takes good 2 years before you expose your naked scars to the sun. The best way is try to protect it with mechanical measurements, which is the 100% SPF bathing suits that prevent the exposure of the sun to the skin.
This is one thing that I feel like doctors don't tell you about after surgery. And I like to document all my procedures and be very transparent with my followers and my fans, because they're always asking me about the unforbidden conversations that nobody's telling you about. One of the things I shared with my followers one day after I had a BBL, I was on live and I just started crying. And everyone's like, why are you crying? And I'm like, I really don't know. I'm just so emotional. I don't know if I'm happy with my body. I'm not, these are not sad tears. I just was so full of emotion. What is that, Doc? Like, what are those emotions? And
well, it's multiple things. You can explain it as something that is related to the hormones of happiness, of sadness that that are in your brain that get altered because of that alteration of fluids and trauma and inflammation and things like that. It's kind of the baby blues in women that have babies, you know? They have the most amazing experience in the world of having this thing that was growing for 9 months and you want to meet them. It's the emotion, it's happiness and all those things. But they feel like lonely, detached, and guilty, and all those things. All the changes in the body, it's like all these disconnections. But it has to be with the hormones of happiness.
The psychological part.
Correct.
What do you recommend to help with that?
Well, just be aware that that's happening. Once you are knowledgeable of something that can happen during surgery, especially people that take antidepressants prior to surgery. The antidepressants get a change in the concentrations or levels in your blood because of the trauma and the inflammation. And then the effect is lowered. So you are somebody who takes antidepressants prior to surgery, get in contact with the person who's handling those medications so they can adjust after surgery. But you're somebody who doesn't take these type of medications. If you are aware, be prepared of it. And that's, once again, before you take a pill, have supportive group around you. They say, hey, be aware if I feel sad or whatever, pick me up. The same way that when you call your friend, hey, my boyfriend left me for another younger lady, whatever. What do you get? Surround that person, pick it up.
Right.
And get them
Make sure you have a supportive group around you while you're recovering, because you're going to go through these emotional and psychological changes, and you may not have an answer for why you're going through these things. Right.
But if you know that it can happen, you'll say, okay.
You're prepared.
Once again, it's the same as going for your marathon, or it's the same as exercising, getting
prepared.
Exactly.
Getting prepared.
Same thing. Same principle.
Doc, the biggest question I get.
Me too.
Sex. Sex. When can we return back to sexual activities, especially after a BBL, a tummy tuck, and what preventive precautions do you recommend people to take so there is no risk in that time frame?
Well, there is always a risk of getting pregnant.
You find that a lot? You do a whole body.
Yes.
My friend, she just had a gastric sleeve, lost all this weight, and now she's freaking 7 months pregnant. I said, what did you do it for?
Well, we know what she did. But
we know what she did.
It's a secret. But important things are, I always joke with my patients, tell them, do you know what the number one complication of this procedure is? Let's say breast augmentation, tummy tucks, BBLs. Pregnancy.
Because he's going to enjoy that new thing.
Oh, exactly. They look much better. They get the attention that they didn't get before. Boom.
Everybody wants to hit it now.
Exactly. So that's one of those things that happen. And it's true. It's something happens. So you be aware.
Because your confidence is up. Now you want to have sex with the lights on.
Well, but be sure that, unless you're looking for it, but if you pay all this money and it's waited all this time to get the figure that you wanted, obviously pregnancy is going to not ruin the body, maybe improve your life because it's a human being in your life, but be aware that it can happen. So take the measurements. So protected sex or IUD, I don't know.
Doc, I don't have any children yet. I haven't pushed any out. I'm actually considering a surrogate to have children because I've done all this work on my body, and I'm nervous and scared that it's just going to all be out of whack once I push out a baby. I know there's a percentage of I could have the baby afterwards, get back in the faja, and everything just snaps back beautifully in a perfect world. But listen, what do you tell the women who are like, okay, listen, I don't have any kids. I've done all this work on myself.
It's very simple. It's just, if you have not had a tummy tuck, let's say, and you are in that potential age that you can get pregnant.
If you have not had a tummy tuck.
Have not, and you have not had a baby. So just have your baby and then come back and do it once. Because once you do a tummy tuck, it's harder to redo it and have a nice outcome. Because you tighten things, baby grows in different ways.
Right.
The deforming of the belly is a little bit different, more towards the sides, maybe a little towards the top. It's a little bit difficult, and then you cannot remove all the skin from the belly button downwards because there's restriction on how much you can remove because you already removed some. So there are some limitations that you can do. So the wise thing is have your babies come and we'll do the thing. If it happens, we can potentially do it. It depends on what the level of deformity is. There are some other techniques in which you can remove skin upwards. It's called a reverse tummy tuck. But once again, I need to see you.
We talked about that earlier because I got a breast lift. And I told him, I said, it feels like a reverse tummy tuck because of the way that they pulled the skin up.
Correct.
So it stretched, the skin and everything like that. I was asking with the tummy tuck if I forgot my train of thought. I'm sorry. With the tummy tuck, and I've never had. So you're saying I have to have my children first before I have the tummy tuck.
Ideally.
Ideally, because okay. So is there a situation where if I had a kid, I may not need a tummy tuck afterwards?
Yeah. So look, it's just not because you are tall and voluptuous, you have to marry a taller guy that is super muscular and super model. You know
right,
what I mean?
Right.
You can get a short one and it makes you as happy as possible. So at the end, the important thing is what the problem is. And let's talk about this, mommy makeover. So mommy makeover is changing those things that change during pregnancy, usually the breast and the belly.
In the belly.
So you'll say, okay, let's have a mommy makeover, but we need to talk about the details. So you can have been pregnant, but if your breast didn't sag and you just simply lose the volume, a breast augmentation will do the job. But if you have sagginess of the breast, then a breast lift will do the job. Okay. But if you want to be perkier, not too fallen and bigger, then a breast lift and an augmentation might work. 3 different procedures, 3 different people, same pregnancy.
What's the most common with mommy makeovers?
Usually, well, it depends. Once again, it depends on how the
baby affected your body.
Exactly. I have many people. Today, I saw a lady, 3 babies, and the belly doesn't look that bad at all. So a liposuction makes sense for her.
How do you get lucky like that?
Well,
is that just genetics?
They pick with their parents.
So the guy has something to do with the elasticity of my skin when I have a baby.
Correct.
What are some tips of safely, comfortably using the bathroom during recovery? Like the faja, I love the fajas with the pee hole. And I like the one that zips all the way up to the butt crack. Because if you have to do a number 2, you don't have to take that whole thing off.
Yeah, but my question is, how do you prevent from the stool to smear or contaminate the thing?
I've had some good luck, so I'm just gonna say I've had some good. It because I have the faja on and that's zipping it. It got good aim.
So the bottom line is always have a backup and be mindful that a stool. So have somebody reviewing and revising that you don't have a stool around because that can be a source of infection. And the other thing is pad the area with paper or something like that in such a way that it smears around, then it's protected, and then you have a backup. You know.
What would you recommend as far as like, because I see like these pee cups for women after surgery. Are those necessary?
I think it works.
They work?
Yeah. It collects, it's like a funnel.
Okay.
So it collects, it prevents splashing or smearing or falling around. So it kind of conducts the urine to where it has to go. So
we're aware that a lot of your patients travel from all over the country.
Actually, I have every zip code in the country. I haven't had Alaska. No, actually I did one from Alaska, one from Hawaii. So all the West Coast, all the Mid-American, all the East Coast. I have had some people from actually Europe and Africa.
So what do you recommend them getting back on those long flights? I live in New York. Mm-hmm. I barely can handle the 3-hour flight on the plane. I mean, when the plane takes off, I get on my knees, I have my pillow, I'm like this in my seat, I get real comfortable, and that's how I ride for 3 hours. But I couldn't imagine someone coming from Europe, coming from Hawaii, coming from these long places where they have to just get first class.
That's one thing. The second thing is make sure that when you go back, you are more mobile. So you can stand up and walk, because you can walk in the airplane, you know?
The compression socks on the plane.
Super important. Another important thing that I'm a big advocate of. When I was in my training in plastic surgery, I used to do research, and did venous thrombosis research was a very important part of my exercise as a resident, and then publicating in plastic surgery. The important thing about DVT is that it's a topic that it happens in which people have clots in their legs and those clots can travel to their lungs. And it happens more frequently than we know in plastic surgery. So prevention is the best way. So low risk factors. So there are some scales called a Caprini score. It's like a table that has, hey, have you suffered from this? Have you suffered from this? Is your BMI this high? Is your surgery longer than 45 minutes? Blah, 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 blah. Do you have past medical history of blood clots in your life?
In your life.
In your family, blah, blah, blah. You get a number. And if your score is lower, in theory, just the compression stockings and walking is enough. If it's a little bit higher than 5, if I don't recall wrong, then you need injections of blood thinners. It's very important, especially for long flights, to get those injections because it prevents the clots from happening, and then you will be better.
Is this something the patient has to be knowledgeable of, or this is something that you, Dr. Alvarez, recommend to your patients who come from all over the country?
All my patients get it. Only patients that I am more judicious to give it to is people that I have a breast, because in my practice, when I give it to people that I did breast lifts especially, I had more complications with hematomas, which is collection of blood within the tissues that I open up.
Wow.
So that's the only place that I kind of hold on it. But if they need to do long flights, they can get an injection prior to your flight, so they have the prevention against the...
And then once they land, what do you recommend?
Walk. And actually, we recommend our patients to walk immediately after surgery.
Even on the plane, get up, walk around a little bit.
Actually, immediately after surgery, which is the day after.
Right.
When they're at the recovery room or the rooms where they're recovering. And then obviously during the flight.
What's the most unexpected question that patients ask you as they recuperate?
Well, not unexpected. I will be very expectant. We touched the topic, but we didn't develop it, which is sex. So we talk about, hey, whenever you feel comfortable, that you don't have pain, that is uncomfortable for you, and you're going to get a joy out of it, not just getting joy for the other person, which is a philosophical question.
Doc, afterwards. I was numb down there.
Of course.
I was numb. Like we tried it, and I was numb. I couldn't feel anything.
Because you're swollen.
Yeah.
That's one thing. The second thing is avoid direct contact to the wounds. So you have surgery in your breast or surgery in your belly, the guy cannot be in front of you. So you need to be creative.
No missionary, ladies.
Correct. But there are some other positions. Actually, we're doing an exercise. I took the exercise to get a Kama Sutra printout and analyze every single position.
Tell me some of those positions.
Well, I cannot disclose it because part of the research and development process for our new publication.
Well, let me know when you finish researching and developing that.
But something that we're going to be doing is assigning potential positions that you have available for the different type of procedures.
Because when I got my BBL, I'm going to tell you, it was probably months before I was comfortable with, my significant other getting behind this thing.
Correct. But there's an important thing. I said the person cannot be touching the area of the surgery. So in a BBL, he cannot be from behind because he will be touching the back.
But even the missionary wasn't comfortable because I have to lay on my back. And because now I have this small waist and this large bottom, so there's a gap in my back, in my lower back. So missionary is not even comfortable.
Exactly. So there are other positions. And I have been describing this in this potential podcast or video we're going to develop for our patients. But the important thing is avoid contact with the surface where you have surgery with.
Ladies, I will give you one position before Dr. J.C. Alvarez is ready to reveal all the other positions. One of the ones that worked for me, I placed on the edge of the bed, I put a pillow on my stomach. Mm-hmm. So I had cushioning on my stomach and my breast area. Not that they were operated on, but it was just a good cushioning. And I stood up and bent over instead of laying down, instead of like on all fours, instead of missionary. I found that position to be more comfortable. And then on my side, the side position was worked for me.
Actually, one of the things that will be a release, a little bit early release. There is a position, I don't recall the exact number, in which the guy is underneath and his legs are closed. And she
I'm trying to
is
get a visual, Doc. Go ahead.
and she is immediately on top of him, like emulating the body.
So we're both laying.
And the legs are a little bit open. So in that way, her whole body is in there, and there's no contact to the surface area.
She must be a small female.
Well, he has to be a bigger guy.
Because I don't think I'm laying flat on my man like that.
Well, you need to upgrade then.
Yeah. I need to upgrade. You hear that, babe? It's time for me to upgrade. Dr. JC Alvarez.
Yes.
I am your host, Holiday, the Golden Child. You are here with Plastic Surgery Tales. And we could not let you leave without getting some of these rapid fire questions in.
Sure, I'm ready.
We love all the technical talk. We love all the information that you're giving us. But the fans and the followers, they want to get a little personal with you and a little spicy too.
Okay.
You okay with that?
We can handle.
What's your favorite travel destination?
Actually, I just came from a long trip, 33 hours in Bali.
How is Bali? That's like the new destination now.
Yeah, a lot of contradiction. Beautiful from the standpoint of the smile of the people, and how simple they can live and how they can make a living out of very little resources. Tons of poverty. Even though obviously we were in nice places, but the food, sometimes there are mosquitoes or flies on top of it. So it's the contrast of something very tasty and then have the flies around. And I had to say, I have been there. I have been in Dubai, which is kind of the excess of novelty and modernism. I have been in Greece. I have been in Spain. I used to live in Spain. I was in Santorini and Mykonos.
Mykonos.
But I always get to the same conclusion. Nothing like Miami.
Nothing like Miami. I lived here 10 years. I'm from New York. I moved back to New York. And I love Miami. But nothing's like my city in New York, you know. What's your favorite surgical procedure to perform?
I have many.
And why?
I will tell you a secret. I used to hate liposuction.
Why?
Because I thought that it was a very mechanical surgery where you didn't have much sculpting of things. It was mechanical. Until I started developing my technique for high definition liposuction and I started getting the numbers. And I'm like Leonardo da Vinci. I love measuring and trying to figure out what is the right recipe so I can repeat the recipe.
Give the best curves.
And then I started like 3 years ago to develop it, and I fell in love with it because I love to sculpt, I love to paint, and that was the perfect blend between plastic surgery, which is what I do, on art. So that's one of my favorites right now. I love rhinoplasty because it's the challenge of a very small area in which you move 1,000 things, and getting the perfect result is always a challenge. So I love that one. I love tummy tucks because I think that I have perfected the technique to a way in which many times people look like they went to the gym even though they haven't touched the gym. And breast augmentations because it's fast and every single patient is happy.
I had a doctor one time tell me he could not do a breast lift on me because he hated, there was one of the procedures he hated doing because it was so tedious doing a breast lift. So I had a doctor tell me he hated doing that. And I have a secret to tell you, doctor, by you mentioning rhinoplasty. You mentioned, especially when it's done correctly, it's such a tedious procedure. There's no room for error when you're doing a rhinoplasty. Right. I had my nose done.
That looks very nice.
Thank you. I did it 8 years ago. And so many people told me not to do it because, you know, one wrong move, you're out of here.
Correct.
And
African-American noses are hard.
Yes, I've also heard that too. I went to a doctor who he specialized in ethnic noses. This is very important, guys. When you are looking for a doctor, make sure he specializes in whatever you're doing. There's no, I mean, I'm sure there's a doctor that's just good at everything, but you have your specialties. What's your specialty?
Actually, I would say that I'm an old schooler, that I focus on specific things and get very good at those ones. So I would say the majority of the things that I do is body. And high definition and skinny BBLs is something that has become like
Popular. All my skinny friends, they're like, "Can I get some of that behind you?"
Yeah. But with the right technique and the right concept and the right accepting the right conditions of the procedure, I think it can be done
It
successfully.
can be done successfully.
But there are some passions, you know what I mean? For example, rhinoplasty for me, since I remember when I was doing cleft lip and palate and rhinoplasty
And
in
that's
kids with
difficult.
those difficult
Oh, wow.
cases, I fell in love with the thing and the challenge. And I love face, but for Miami, it's not kind of a typical thing, and you spend too much time, and maybe it's not cost effective for what we do. But rhinoplasty is one of those surgeries that I'm not going to renounce to because I love it so much, same as eyelid surgery. I miss doing faces
You miss doing faces.
because it takes so much time, but
Zach, what you think I need?
nothing.
Good answer. We're gonna be friends a long time. If you weren't a surgeon, what profession would you choose, and why?
Engineering.
Engineering, like what type of engineering?
I would
Music engineering, mechanical engineering.
Mechanical.
So like airplanes and
I don't know. Well, now that rocketeer engineering is the new thing. Maybe that because of the level of opening of creativity.
aerospace.
Because creativity is what moves me. So I think that that's an area.
I think ultimately you have to be a creator and you have to be able to think out the box like a Picasso or something to be able to even be a plastic surgeon. Because you have to have a vision. I think plastic surgeons, musicians, and athletes should just all be best friends.
Yeah.
Because they have the way their mind works, eye-hand coordination, creativity, and having a vision and being able to execute it before they execute it.
Correct.
Yeah. Dope. So you still would fall in the same lines of being able to be...
Yeah, but I love numbers. So that's what doesn't apply to medicine. But I'm a Gemini, so I'm a...
Oh, you're...
So I'm
We're not going to call you crazy, but you got two sides to you.
Correct.
I love that. But you said you love numbers. One thing they say is men lie, women lie, numbers don't.
Correct.
What's your favorite ice cream flavor?
Raisins and rum.
I swear to God, I was just thinking that in my head. I said, he's probably a rum raisin kind of guy.
Yes, I am. It's delicious.
It's delicious. I should have just said it. Your all-time favorite movie. I'm going to say it because if he says it, then I want to know that I'm a little psychic. I feel like you're like a Scarface, Al Pacino type of guy.
Actually, I saw that movie very late in my life. I kind of understood it. And obviously, it's kind of the Cuban thing.
Yeah.
But
Are you Cuban?
No, I'm Colombian.
Colombian.
But Miami's Cuban. No?
Yeah.
But I love the series of Back to the Future. It's a guy that goes in a time travel back into the future.
Back to the Future 1 or 2?
Actually, I would say the third one.
The third one.
Because it was more challenging to get to the future.
Your guilty pleasure in food. You said you're Colombian, so... Have you ever been to Puerto Sagua on South Beach? No. Amazing Colombian restaurant.
Really? How's it called?
It's called Puerto Sagua.
Puerto Sagua. Okay.
Yeah, it's on Collins, and I think it's like 7th.
Okay.
Yeah.
I will
breakfast, dinner, lunch, amazing. But what's your guilty pleasure food?
I would say tiramisu. Because it's coffee and chocolate.
Coffee and chocolate. Yeah? We have such great teeth. I wouldn't even take you for a coffee drinker.
Well, I'm Colombian, so I have to. But
the Colombian coffee, the shots?
Well, no, we take it very diluted. The shot thing is more like a Cuban thing. But softer taste, aroma, very aromatic. So
I love the Colombian culture, the whole idea of the gangsters coming from there, the Colombian cartel, Medellin. Like, I just love there's this Queen of the South. Yeah. She's Mexican, but it just still gives me that whole Colombian vibe. I love Colombia. I love it. I love it. How much is in your bank account? Your savings? You don't have to give us the exact number, but
I don't have much because I invest.
Because you invest. So you make your money work for you.
I try.
And last but not least, this question is not on here, but are you single and dating or in a relationship?
Actually, I'm in a relationship.
You're in a relationship. How's that going, Doc?
Very well.
Very well. Do you take a lot of time from your... Listen, I feel like men make time for what they want. I don't care what your occupation is. So are you making time for your lady when you get home from these long hours?
Well, right now we came out of a trip from Bali, so we're together.
So you had plenty of time to
we try to schedule it. And another thing that we do is she has a foundation. It helps kids.
Wow.
And we try to do things together for the kids. Actually, in December 16th, we're going to Peru. And the mission is to try to help them not only with blankets and food, but the next step for the foundation is to create schools and places where the kids have the tools to get a better life.
To get a better life. Listen, guys, if Dr. J.C. Alvarez isn't a good example of men make time for what they want. So even if he's on the surgery table, he texts us back. He has time to take his lady on trips. Mm-hmm. And if you really have a busy man with a busy occupation, ladies, find your way to do something that complements what he does for a living. Find something to do that complements his interests. You're into children. She's into children. So now you guys find a way to work together so you can spend more time together.
Right.
I love it. I think it's genius. Listen, Dr. J.C. Alvarez, he is board certified since 2012. Do not forget it. I'm your host, Holiday the Golden Child. We're here with Plastic Surgery Tales, and we tell more than just one tale. We told a couple of them. Thank you so much for coming. I just got chills talking to you.
Thank you.